This morning, we are taking a look at the overall health of men. Far too often, too many men skip checkups and stay silent about symptoms. Well, some doctors and a bill with bipartisan support in Congress are looking to change that and end the stigma. Joining us live this morning is Harvard Healthcare's Dr. Brittany Burke, a urologist with Tallwood Men's Health. Doctor, thank you for your time.
Thank you for having me.
Of course. So this, of course, is concerning. Everyone should be taking their health seriously and taking care of themselves. Let's start by asking you this. What steps can providers like yourself take to encourage men to seek routine care?
Well, I think we really have to meet men where they are. Many men only come in when they feel like something's wrong. And so, one of the most important things that we can do is normalize preventative care for men and use every healthcare encounter as an opportunity to take a look at the bigger picture. I think we also need to reframe the conversation. So, when we're talking about prevention in terms of longevity, strength, and performance, this speaks to men better. And then highlighting the importance of being there for their family long term, I think it sends a really strong message about the importance of them taking care of their health.
And as someone who treats a lot of men, why do you think they don't come forward often enough to seek help?
I think that there is certainly a stigma surrounding preventative care. I also think that a lot of the common underscreened conditions that men are experiencing, like, have silent symptoms. And so it really only comes to their attention when the symptoms are severe enough. There is a women's health department in the government, and so that is overseeing women's preventative care. But to date, there really hasn't been anything like this for men's health.
And I understand that that is something that some doctors like yourself, some lawmakers are looking to change. Can you tell us about this bipartisan bill that a lot of people are talking about?
Yeah, so the State of Men's Health Act, or HR 7602, was developed really to sort of formalize the evaluation of men's health outcomes long term and to centralize meaningful data that providers, such as myself and others who are in different fields of medicine, are able to utilize so that they can better address specific men's health concerns. And that's important because we know that men on average die younger than women. They have higher rates of suicide and higher rates of chronic disease, and often are presenting with serious chronic illnesses at younger ages. And yet, there is a lot of data to show that these men are not seeking out preventative care.
Very interesting. Well, Dr. Burke, thank you, of course, for your time and the work that you do.